Well, this is a great day in the universe. Michael, the host, Planetary Health First, Mars Next. I got my co-host here, Suzy, with me, and we got a special guest, a friend that she's been working with. Suzy's always advocating so many special projects she does, but especially pediatrics. So, Rick, before we get going, please introduce yourself. So glad you're here.
Thank you, guys, and Suzy and Michael. Thank you for having us. Yeah, my name is Rick Shorten. I'm one of the founding partners and CEO at BioFlight, and we're a technology consultancy. We work across multiple platforms: extended reality, virtual reality, mobile, and PC and platform applications, cross-platform applications. And I think we're here to talk about patient safety, but specifically about an application we've been working on for several years with pediatric partners called CareXR.
I love it. And, Rick, before we kind of dive into what CareXR is, I'd love it if you can tell me a little bit about the inspiration behind it. And Dr. Chogle, who is a physician over at Children's Hospital of Orange County, now part of Rady Children's. I'd love to know a little bit about that and have people, understand where this kind of came from and the inspiration behind it.
Yeah, for sure. So they reached out to us in 2022. And that tends to be, that's sort of how we've developed. We're content creators and we're technologists, and in the education space and specifically in healthcare. And so they reached out to us through the Innovation Lab, which is sort of an offshoot of 6 hospital systems that are all very focused on using technology to advance, education and medical care. And Dr. Chogle and Wanda Rodriguez, who is an RN, a CPN, and a bedside, nurse, they had done a hackathon, from my understanding. And the purpose of that weekend hackathon for them was to better educate patients, at time of discharge, because they were struggling with patients leaving the hospital after medical procedure, medical device implanted. Dr. Chogle is a gastroenterologist, and now he's, I believe, chief gastroenterologist at the hospital. And his patients were really, they weren't confident. They were stressed out. There's a lot of anxiety, obviously, when you have a child leaving the hospital with a feeding tube or a PICC line or some other medical device, a complicated medical device. And I can only imagine, when you're being given a child after a major medical procedure and they're going home and you have a thick book of instructions and you have limited time with a medical professional. And for the next 6 weeks, 8 weeks, it's your job as a parent to care for your child every day with all of the myriad of steps, that need to go into the care at home for these medical devices. They were struggling because their parents, and the caregivers were struggling. So the concept was to have an application, an interactive application that they could use, at bedside at time of discharge, that the parents could go through in order to build their confidence so that when they left the hospital, they would feel like they had a chance to practice the steps virtually, for the procedures that their child had gone through, the care that was going to be required post-discharge. So when they got home, it wouldn't be the first time that they'd gone through it, right? Repetition is pedagogy. So if you've gone through things multiple times, you've got that sort of muscle memory, you've done it over and over again, it becomes sort of second nature. And at least to the point where you feel like, okay, it's not the first time I've seen all the different, the different component parts of a kit for a G tube. I know what the tubing is for. I know the ports. I know the different, gauze kits. I know all the different, syringes and all the things that go into, when I take one apart, I know what it looks like. It's not strange to me. It's not foreign. And so I believe the genesis of that was, how do we do a better job educating patients, in clinic when we have access to them before we send them home with their child? And so that out of that weekend came the idea for CareXR, but then they have to build it. So they reached out to us in partnership and said, how do we put something together, guys, that we can test with our patients to see if this is the right pathway to have a resource that our staff can use in education and then patients can use post-discharge to support them at home.
And you got very lucky having Wanda as part of this team too, because she is a phenomenal educator. I've known her for years. She's fantastic at what she does, but she realized, like, even the best educators, when you're only telling a family one time or maybe a couple of times how to take care of a device when you go home, oftentimes it's not enough. There's so many other things that caregivers are stressed about when they take their loved one home, whether that be a child or anybody else. And, to remember all of those steps and to think, what do I do first? And when do I flush the tube? And how does this all work? It's a huge problem. And it's not just, Children's Hospital of Orange County that I've heard this from. And so I was so excited that this project got started and that you were involved and ready to take this on. So I'd love to know a little bit more about, where you guys are at now and what kind of modules you've created and, how this is all working. Because I know you've got the VR component that you can use inside the hospital to repeat the process as many times hands-on as you want to before you go home. But then now you also have this great companion piece where they don't necessarily have to have a VR headset at home, where they can remember, get some retraining at home if they feel like they need it or they need that reinforcement. So I'd love to hear a little bit about that.
Yeah, so we built this as a VR, as an immersive, in the environment application. And there's a million studies that, I'm sorry about that. There's a million studies that have proven that, the immersive nature of VR is a superior way to learn. You're not distracted. You're in situ. You're in environment, and you can just focus on the training. And so you can go through it step by step. It feels very real. Everything is laid out in front of you. It's life size. It's life scale. And you can go through each of the steps, one by one with what seems like a real medical, device in front of you. And so that's how we built it. And then, we started with the PEG tube. Sorry, that was what went through clinical trials. So we built out one whole module. This was all of the steps that Dr. Chugli and Wanda, that this is what they teach. So the first thing we did, obviously, was we built out an animation to explain to parents what their child goes through. The first part of any medical procedure is having the patients and parents understand what their child's going to go through. Like the anxiety starts the minute you tell a parent their child needs a medical device. And so a nice benefit we're seeing from creating this module is actually the animations that we've put together, to teach the patient about the sort of physiology, the biology, and actual, what happens to their child. So they get a chance right from the beginning to sort of understand what's happening to their child. So they get that. They understand, from internally how it's all done. And then from the inside out, they're taught all of the different steps sort of modularly. So it's very snackable, easy to understand, step-by-step, interactive, procedure steps that they get to go through interactively with the VR. So they get to do that first. And that was the first one we built. Then we just moved down the line, and what we're targeting is the sort of more complex procedures. So feeding tubes are complex. There's so many different steps at home you have to do. You mentioned one of them, like changing the ports daily, sterilization, medications, flushing the tubes, and maintenance. And so we did PEG tube. Then we did a button, which is a variation of that. Trach is another big one, and PICC lines. There's beyond pediatrics, there's like 3 million PICC lines that are done across the U.S. every year. There's 3 million adults and kids that go home with medical device that need cared for, and they're in from weeks to months. And so there's a lot of education that goes around medical devices, one example. But that's where we started. So we started in VR, and then realizing that it's great to have that in the hospital to sort of extend the training that that Wanda gives for the classes that she puts patients through. But not every parent can attend the class. Not every caregiver that is responsible for caring for the child once they get home. There's a lot of extended family. There's grandparents, there's uncles and aunts and sisters and brothers, and other people that aren't there at time of discharge that are also responsible for caring for the children at home that don't get the benefit of the class. And then there's also retention, and there's the idea that what you were taught in the hospital for that hour class, it's how much do you remember 2 weeks later about that 12 step, that you were taught at the time, even with the VR, how much do you retain? And so, the feeling was, how do we follow them home? How do we give them a companion application, either for a refresher or for the extended family or caregivers that weren't able to access the VR? What can we give them at home? So we sort of reverse engineered the VR for tablet and for PC. So what we have now is a published application for the PICC line. We picked that as the first one just simply because there's so many that are done. And our provider partners said, hey, we'd like to have that first, just simply because we do so many PICC lines and our families struggle with that. We'd like that one done first. So we have in the App Store now, if you go to Apple or Google Play Store, you can download that application and you have that as a resource. And it's sort of built the same way. You're in a virtual environment and you can tap through all the different steps It's all chaptered and modularized, so you can jump to the step you want to learn. And it's built the same way. We have videos of Wanda training, so you can watch her training curriculum video, and then you can step into the virtual version of it where you go through and you tap and touch, and all of the steps sort of happen in front of you animation wise. So you can learn all of the same way, very similar to VR, but you're not sort of reaching out and interacting like you would in a virtual environment, but all of the interactive steps are there for you to learn.
So Rick, you guys are live now, and this is being used at the outpatient in the home with families currently, right?
That's right.
And how long has that been going on?
Well, the in-home version only got published the end of Q4 2024, so it's early days. And in order to sort of support, we know the VR works with patients; they love it, and the nurse educators at Chalk love it, and Valley Children's, that's another one of our in-network hospital systems that are using it with the nurses on the ward and their families. They're doing a second clinical study to sort of prove efficacy. What happens to our readmission rates? And we didn't talk about that at the beginning, but that's the problem, is that parents are going home in the sort of first 30 days for any surgical procedure or medical device. That's the window of risk, or however you want to phrase it. That 30 days is where most patients struggle and they come back to the ED. And so that's the window. That's where we're trying to make the most impact with CareXRs. How do we support them in that transition from hospital to home, and keep them out of the ED for better patient outcomes, number one, but number two, so they don't come back with infections and complications, to put stress on the hospital system and.
So what are you finding right now, Rick? Are there some trends you're finding? I think that would be, it's unfortunate this discharge happens. It's a black box typically, and now you're really unlocking real-time data. What are some of the trends you're finding, lessons learned to help these families? Because I imagine the training in the hospital with the amazing Wanda is one thing, but then when the rubber meets the road at home, it's like, oh shit, this is what a pick is, or what is, what are you seeing so far? I'd love to know that.
Well, we're going to get, I can tell you that, I'll have numbers to back up anecdotally what I can tell you today, but what we're finding through our, our interviews with the families is that, having a resource beyond Google searches is massive. So, you don't have a virtual nurse. You can't always reach out to a very stressed out, depleted medical team. You don't always have a telemedicine option or a virtual option to reach out, at midnight when you have to remember that third step. So I think the parent groups and the patient groups, the populations that are using the application are finding it invaluable, just because, they haven't had a resource. The other thing to think about is that, the teams that are using it in the hospital, they now have a standardized version of how to teach patients how to do this. And if you ask any nurse team on a ward, if you ask 10 nurses, probably 8 of the 10 would teach it a different way. Yep. And so you've got 8 different versions. They have to teach standard of care and align to care standards, but there's subtle differences. And so what we're seeing is that the nurses that are all using this CareXR as a resource are now learning it the same way. The new nurses that are using it to onboard into Chalk are learning it the CareXR way, because that aligns with Chalk's standard of care. And they're teaching the patients the same way. And when the patients go home, they're reminded to do it the same way that Chalk teaches it. So you've got this through line of standard of care and aligned to care standard. So everyone's running from the same playbook. So there's never a question about what they're supposed to do and which way they were taught to do it, because everyone's teaching it the same way, and everyone's learning from the same blueprint. So
Rick, are there systems in place where you are going to spread this diffusion of knowledge to other health systems, other regions? Is there anything like that in the works for this?
Yeah, I think the biggest barrier, I think, for us has just been the fact that it's been a VR focused product up until 3 months ago. And I think for a lot of health systems, that technology barrier has been there. I think a lot of health systems look at that, the IT departments, and it just looks like another thing they have to learn, another thing they have to manage. And if there's anything in a medical like delivery of care workflow that they think is going to slow them down, they don't want to deal with it. And so that's been a barrier in our discussions. They love the idea. They don't argue that it could benefit patients. It could actually save them time because they could, give the headset to the family, at day of discharge and let the family go through the training, and it frees up a nurse to go off and care for more families. But it's not standard practice. They don't do that in their day yet. It's not how they were trained to do it. But if they had, they all walk around with tablets on the ward. If they had a tablet and they just had to give it to the patient to go through on a tablet, or if they just said, look, here's your discharge paperwork, there's a QR code on your discharge paperwork for CareXR, scan it, and go through it here. If you have any questions, go through it and let's talk before you leave, as part of discharge. Or when you get home, you'll have it on your tablet or on your phone. And we all know it. This is our training. This is how Chalk does it, or this is how Rady's does it, or Valley Children's, or Boston Children's, or Texas Children's, or Providence. This is how we do it. So if you have any questions, when you contact us, this is how we train. You'll always have this resource, and we have the same resource. So to answer your question, yes, we want every health system to look at this and say, how do we make sure this aligns with our care standard? Let's provide it to our practitioners so that they look at it, review it, and believe and trust it. And then let's make it available to our patients. I mean, it's there, it's available. There's no barrier now. It's on every device that every nurse carries around on the ward, and it's available to every patient for every smart device that they all have. So the barrier is down now. And so what I would think is, beyond the VR, if that is a step too far still for a lot of hospital systems, the fact that it can be on your PC or on any smart device that people have in their pocket, I think that should be settled at this point. Now it's just the content's there, it's needed. So let's just get it into the hands of the people that, let's meet the patients where they are. And that's in that transition from hospital to home. So let's make sure they have it.
So Rick, I know you developed this initially, with the pediatric hospital, obviously. And I'm so honored that I kind of got to be there in the very beginning, and now get to see this grow and see where you guys are now. I know the intent, though, isn't completely for this to be just for pediatrics moving forward. So it can really be used for any patient that has whatever, a trach or whatever it is that they go home with. So what are your plans to kind of expand into other patient populations? And then I'd also kind of maybe as a follow-up love to know, what are the next modules that you're looking to create?
Well, another reason why we chose PICC line is if you look at our PICC line model, it's not a child in front of you, it's an adult arm. And the steps for PICC is the same for pediatrics as it is for adults, with some very minor things. So we actually built that module specifically to be patient population agnostic. So anybody who gets a PICC line, inserted could use that module today. We did that on purpose because we wanted to make sure it was accessible to both patient populations, because we, for the same reason we just talked about 2 minutes ago. Like, it's really important that this becomes standard of care. Like, when you get discharged, you should have an interactive, educational resource that you can download and use on your phone. And you shouldn't, it's great there's WebMD and some hospitals have, patient resource pages that you can go and read information about care, but it's reading. And, anything that's going to slow a patient down or get complicated, they're not going to do it. Like, they won't adhere to a treatment plan if they don't understand it, right?
And the problem with those tools too is that, it's not going to be taught the same way it's taught in the hospital. So you could have the caregiver bedside tell you one thing, then you get like a sheet that's been photocopied 12 million times in the past 20 years that you take home with you that might have some little subtle nuances. Then you get stuck at home and you start Googling, YouTube videos and WebMDs and everything else. And there have subtle differences. And that's when people end up back at the ED for readmission, because all of a sudden the parents or the caregivers panic and are like, I don't know what to do now. So I think having that consistency of how it's taught in the hospital and the consistency of it's being taught exactly the same way over and over and over again, there's never any nuances, there's never any differences, is huge in kind of solving this challenge that you guys set out to solve. So I love it for that reason. I think it's going to be really important, and it has been really important, and it's just not been addressed up to now.
Well, and just to finish that point, Valley Children's, the button version, like, there were specifics in a couple of steps that they taught exactly. They taught it differently.
Yeah.
There were 2 or 3 steps that they taught differently, and they said, can you just tweak those 2 or 3 steps, and then it aligns. That aligns with our standard of care. It took us 3 days. and
Yeah.
then the version that Valley Children's puts out is how they teach it. And that's done. And so that customization, the way that we built it modularly it's easy for us to do that. And so now that represents how Valley Children's teaches it. And like you said, it's a through line. There's no variation. And like I mentioned, if there's any doubt in a patient's mind when they get home that they're doing the right thing, they just freeze and they won't do it.
Yeah.
And they'll go back to the ED, and that's a $25,000 drain on resources, and there's a million reasons why that's a problem for our health systems today, for everybody, regardless of whether the hospital pays for it or Medicare pays for it or whoever pays for it. It's just bad. And so that, if that doesn't have to happen, if it's a preventable, readmission, and 50% of them are, why are they still happening? If there's a way for us to help them care for themselves at home and make them confident in their care at home, if we can do a better job of that, we should be doing a better job of that. And if it's not technology that's standing in the way, and it's not cost, because right now I think our app is $10, what is it? What's standing in the way? You know what I mean? So so and if it's not customization, if Providence says tomorrow we want to download CareXR, we want to make it available to our patient population, but Rick, the PEG tube or the trach tube thing we do is just slightly different, then give us 2 weeks. Give us 2 weeks and it'll be changed, and it'll be branded with Providence, and they'll download it, and we'll have Providence's logo, and it'll be the Providence way, and it's the way you teach your patients at Providence. It'll be done that way,
That's awesome.
And Providence patients will hold it. We're not trying to put barriers in the way of that. We're trying to get it out to as many people as possible because we think there's value in that. And I think that's been the brand motto. It's not just our brand motto, but it's that whole idea of do good by doing well, or do well by doing good. You pick one, flip it. It works both ways. So that's how we've tried to position the product, is to make it extensible and easy for people to access, number one, and cost not to be a barrier, and then certainly being able to modify it for that reason. They're just we're not making it hard for anybody to get behind it.
Bring some comfort too, that if a new best practice comes out for some kind of device down the line,
right.
that you can easily create those edits and make those changes. Luckily, I don't think a lot of that stuff changes as much. Like taking care of a trach is taking care of a trach, but you never know. So I think, giving some level of comfort that, hey, there's a new best practice, that's come out and we can easily change that, I think makes a big difference too.
Rick, we start national alignment of care. This start just to say that they'll say, well, who came up with this? This is national alignment of care. This wasn't just Rady's children telling us this is how it's done. They help guide, but this is national consensus and national alignment of care. So we start at a national level, and then we customize to market, just so everybody knows.
I would hope there would be some best practices regardless across the board with discharge planning. I've been dealing with this. I have aging parents. We've had, also on my wife's side, and the discharge that happens, it's like, what happened at the hospital? I almost think it should be proof of life, of care, of what happened, whether it be for stroke, dementia, what medications. I feel like there's so much area where we need to get it right. And I think, you as a startup with a niche, you're going on with a specific, really granular issue, but really across the board, discharge planning, what happened, who, what, when, how, and then what are we supposed to do? What medications were changed? It is with this multiple caregivers, it just seems like this is a huge area where you could be like the standard of something of this happened and this is how you should do it when you go home. So I don't know if you have plans to partner another wider spread. I mean, I know you're starting with the modules doing that, but it just seems like discharge is a nightmare and really frustrating.
Yeah, and I'm glad you brought that up, because part of my thought, we've had part of our discussion with I'm based in Cleveland, we have a West Coast team, and I'm sort of the Midwest team. Part of our discussion here was with university hospitals. They're super progressive, just like the clinic here is super progressive with technologies, and there's a huge move to self-service healthcare and the idea of empowering patients. And there's a lot of great startups doing that, addressing that, how do you walk patients through their care journey, and how do you support them, because there's so many moving parts. And not every part of the like you get, depending on who if you talk to 20 people in the hospital, they're all responsible for giving you 20 different pieces of information, and then you have to collate that as part of your care journey and keep track of that and what you need to know at what part of your care journey and when you need to know it before every consultation, before every meeting, before every treatment. Like, how do you keep track of that as a patient and certainly as a caregiver? And if you're a caregiver to a parent, if you're a caregiver for an elderly parent who has diminished capacity and you're trying to manage that. So, we were put in touch with a startup. They're more than a startup now. They've been in practice for a while. They're called Inside Out Care. And we had a great conversation with them because they do checklists. They have this whole app that does the management of care for a care journey. But what they don't do is what we do, which is patient education. So they cover the coordination of that journey, but they're not educating patients and all the things we're educating. So we fill in that gap, that training gap and education gap. We step in there. So the idea is like, the first three modules in the patient education journey, or a patient care journey would be Inside Out Care, and the fourth one is us. So the idea that we would just slide seamlessly right into integrated into their app has already been discussed. So we love the idea of being like a partner in a scenario like that. Like we don't want to build everything. We want to we want to stay in our lane. We want to work with other great startups that are solving other problems like what you mentioned, and just do what we do really well, which is take medical knowledge, take all these really smart people in the hospital that know how to train and have the medical expertise, and audit that and turn it into something at a medical literacy level that patients can understand, and turn it into visual learning and let them access it so that they can understand complex concepts and be able to do this at home. And then take that and white label it and put it into other applications that make it better and stronger, because those other applications address other problems to make it a holistic application like what I just mentioned.
So speaking of what you do well, can you give us a little bit of background on what you and your team used to do before you started BioFlight? Because I think it speaks nicely to your abilities. Yeah.
Okay. Yeah. So we didn't start. So we started out as a content team. So the half of the group is all. So we're entertainment professionals in Hollywood. So our background is visuals, animations, and visual effects. And so the core creative team of BioFlight, we all worked on shows like CSI and Grey's Anatomy and ER. So we're used to all the biological and physiological animations and things like that. So when we first started doing virtual reality back in 2014, when Palmer Luckey when he owned Oculus before he sold it to Zuckerberg and it turned into Meta, when we first got our, the first DK1 of the headset, and we met him at CES, back in a little tiny booth, and saw his first demos, which were all really blurry and shaky. We thought, how do we translate, the content we're doing into something interesting? At first we thought about entertainment. But because one of our founders, his dad is an orthopedic surgeon, we thought, well, maybe we could do something, education wise in medicine. And that's another podcast. But, that is kind of where we started. We started from an entertainment background where visual was what we did. And so it's interesting that we're a visual forward company, and like everything we do comes from a high end Hollywood visual level. And then we fit that into how do we educate with that look. So we don't go from what's the content, now let's just slap some visuals together. We go from how good can we make it look, but also make sure that we're educating people at the same time. And that's kind of been our calling card, is like, if you look at what we do, other companies that have gotten into the VR education space, if you look at, our demos from 4 or 5 years ago, the stuff they're doing now all looks like what we did 4 or 5 years ago.
Yeah, so makes sense for sure. Yeah. I love that you guys have that background. I just always thought it was so interesting that you came from that world and then moved into the healthcare world. We need a lot more of that cross-pollination, I think, to kind of make it cool and neat. But I just love that you have that background.
People expect it. I mean, it doesn't have to be a AAA video game. There's form and function. There's a balance, but it doesn't have to be hyper real to educate people. But people expect it not to be clunky. They want, if you're doing simulation, they want it to feel somewhat real. If you're having a conversation with a virtual patient or something like that, they want it to feel like they don't want to be popped out of it because they feel like they're talking to like some blocks and pixels. They want it to feel like a real, if they're going to remember it and they're going to, lean into it, it has to feel real and is real enough. And
Yeah.
so, there needs to be more of that. You need to take that seriously. But, for us, being able to tell a story, like when I mentioned the idea of showing patients the actual procedures, there's ways to educate them and make it feel tactile and real, but not to gross them out. And if you do a Google search of like, a surgery for a tube, a button or a trach being done, it's a little scary if you just Google search that. You don't really want a parent seeing that before they put their child through it. So we do a version that's a little bit more PG-13 that at least it lets them understand the procedure, but it also educates them and not in a scary orthoscopic way where it's a camera actually going down the throat and
If you look at anything online for any condition, you'll scare the crap out of yourself.
Vasectomies are a good way too, as from anyway. All right.
No. Some things I feel like I've gotten working on CSI. I feel like I've gotten an associate's degree in medicine, but there's some things I don't want to see, right? So anyway, we do that for you. We look at that nasty stuff, so you don't have to look at that nasty stuff. But yeah, that's always been part of it. So that was our background, and going forward, that'll always kind of drive what we do. So when we work with people and we're trying to audit, those sort of visuals, and we're like, how do we tell a story with the visuals so that, patients understand it, doctors understand it, nurses understand it? We're pretty good at that. We're really good at sort of translating that into something that quickly gets to what people need to see in order to understand it better. And I think that's one of our strengths, is we've been doing that for a decade. So we're really good at that.
Well, Rick, I think we're excited that you made the shift from Hollywood. So good things come from Hollywood to healthcare. But what is the most, like, as kind of still early, not born and raised in healthcare, what is some of the weirdest things? Like, are you serious? Like, tell us like the ahas or the good, the bad that you've come to from Hollywood to healthcare to see how healthcare is and how it operates.
Are you talking about from a visual side or just a business side?
Just as a non-person, like obviously you're not a clinician, you're not a doctor, you haven't lived and breathed, you're kind of an outsider from Hollywood. What has just surprised you, or just kind of your perspective? Would love to hear that.
Well, I mean, I think from our side, from Hollywood side, is that we move fast and break things. And I think that, we generally we'll try things. And then if it doesn't work, there's what's the jeopardy in it? I think there's a sort of, and I get it, there's a science and a mythology, and we're talking about people's lives here. And we want to make sure, that we get it right. It's that whole idea of, and there's a gravity, obviously, to making sure that, when we work with our clinicians, it's, every step is very important. I think what we learned is, if we get one phrase, like one bit of terminology wrong in a step, if we use a wrong word in one step, in one module, it might be misinterpreted by a patient. And they might, if they look up or they Google that term and it's the wrong terminology, it could be wrong. And, we're doing translations. Another thing we mentioned is to address patient populations. And servicing underserved patient populations, and in the Inland Empire and Inland Valley, that's really important in California. And so, just for everybody to know, right now all of our modules are English Spanish. That's where we're starting, but we're looking at Vietnamese and Cantonese and Tagalog and other underserved patient populations. That's always been really important to us. Is that we have to get it right. Like we have to be very meticulous. And I'm not saying that we didn't do that in entertainment, but we could gloss over some of that, right? We could always, like visual led. Like if it looked good, that was fine. If we didn't quite get the science right in CSI, as long as it was mostly right, like that was fine. It told the story. It didn't have to be, we fudged the science a little bit, right? We sped things up, right? But you can't do that here. Like it's really important that we get everything perfect because, we're caring for children and patients. And so that's one thing we had to learn to slow down and pay attention to every single little detail. And I think that, that's been, and it's not that totally surprised us, but we really had to learn that, if we could build something in 10 days, we had to learn it. Maybe it takes us 10 weeks to get that module right, because sure, we could make it look great in 10 days, but is every little thing right so that when a patient and a doctor go through it together, it's not missing anything. And that's critical because
in doing this,
if the doctor doesn't trust it,
Yeah.
Sorry.
I was just gonna say, in doing this, you kind of got a little bit of a crash course into a few little places where healthcare is kind of broken. And I guess what I would like to know is, was that surprising to you? I mean, I think we all know that there's parts of healthcare that are broken, but until you really start to kind of see behind the curtain and some of those things, I don't know if any of it was surprising to you or if it was what you expected.
Um, no, not. I mean, sort of. I mean, learning a whole other business is like, like that's been really interesting the last 8 years. It's just sort of seeing how that functions.
Yeah.
But from our side, what I think what I have seen is just like a real desire from like some really like passionate, really smart people to want to just do their best work and
Yeah.
to really help patients. And then from my side of things, and we're on the inside sometimes and we see it, it's just a frustration. And
Yeah.
and seeing it's sort of that idea of technology like moving them forward, but also holding them back when it's not deployed correctly. And I think that I've seen the inside of that. Like sometimes technology adds more burden than it relieves. And so I think we've been very, 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 deliberate in how we build this out, because I think, as I mentioned earlier, if it's anything that's going to slow a nurse down, or it's going to cause more paperwork, or it's going to gum up their day, or it just technically it's not going to work, or whatever it is, it's not going to get used on the ward. Like we know that they're not going to use it. Like if the app breaks or doesn't load, or it's just something. So we've been really, really, deliberate in how we build it, how the flow of it works. And look, this is early days. Like the reason why we want to get it out to more hospitals to pilot is we know it's not perfect yet. We know there's a lot more work that needs to go into it. Like what I hope to get out of the sort of roadshow, backing into Patient Safety Week that's coming up next month, is we want more hospitals to say, yeah, we'll kick tires on it. Like let us download it. We'll try it with our nurses. We'll tell you the things we hate about it. We'll tell you the things we like about it. This needs to be better. The interface needs to do this. We couldn't find this. We didn't want it. Whatever it is. Like we want to go back and make it better, because we want it to be used. And so that's what, like we don't want it to be just another piece of software that like I get the cynicism, and so we really want it to be we really want them to try. We want to make their life better and easier through technology. And yes, we're evangelists for technology, and we know they're probably tired of like another software, another app on their iPad that's supposed to make their life easier but doesn't. We don't want to be that, and so we really want to work with them collaboratively to do it. But we have been from the inside, and what I think is different from us is that we're not a company from the outside knocking on their door trying to sell them something. We've been working hand in glove with like our medical partners from the inside from like the first day. So we've been listening to them and build it for them. We didn't build it and then come in and say, look at this, nurses and doctors, you should love this.
Well,
it's them saying, build it for us, right?
I think that's such a good point. It's one of the things that I really like about you guys is this has been a true co-development effort. Right. Dr. Choblay's been involved since day one. Wanda's been involved since day one. And they're both phenomenal. They're great at what they do. You couldn't have picked better people to do this with. And now that you're doing some work with Valley Children, I know you have a champion inside there who's guiding every step of the way. So unlike some technologies where they, learn about a problem from a physician or a clinician, then they go back and build, you're actually working with them hand in hand the whole way through, which I think is really cool. I don't see that level of co-development in every single product that I work with. And I love to see it. I'd love to see that true collaboration. It's fantastic.
Yeah. And before we run out of time, you keep asking me the question, what else are we going to build? And I keep not answering it. I'm sorry about that. I think beyond, the things we're doing in pediatrics, obviously, like there's 50 million surgeries in the US a year. Okay. Like there's a lot of white space here. There's a lot of people that get procedures done that go home and need care. And we see a lot of the healing being done, not in acute beds. Like, people are released day of surgeries or day after surgeries. They're not spending time in hospitals. They're spending time at home. There's 13 different surgical specialties, from neuro to pulmonary to respiratory to that there's a lot of white space there for us to cover. But, easy areas are things like chronic conditions and wound care and dialysis. And the move to not going to centers where you have medical professionals watching you, you're not going for dressing changes. You're expected to do it at home. And then you've got home health aides and home healthcare workers that are being sent to your house to do that. Is there gaps in training? Is there that standardized training? Are they all getting the same training? Like if you see different home healthcare workers coming to your house, if it's not always the same ones, are they all being trained the same way? So we're just looking at it like, how do we level the training gaps and make sure that the people at home have resources for their own care, and that we're standardizing training in areas where we know the movement to home, to healing at home and home care. We have resources that, like, we're moving in that direction because that's the way it's going. It's not going to be back at the hospital. It's over the next decade, it's moving to the home. We all know that. So how can we be there to meet those needs in elder care, in like I said, chronic conditions in the home? That's where we want to see CareXR go. And so, as we develop our library and as we resource and take on more partners and more investment, that's where we want to grow our library and our partnerships, is in those areas where we see that acute need.
Fantastic.
Well, man, Suzy, I'm glad you got Rick on. This has been an awesome discussion. Love what you're doing, Rick. Good things come from Hollywood for sure. Even better in healthcare. And then also, as we're wrapping up, it would also be good, how can people find out about you a little bit more about you and what, and also I will have a subsequent follow-up newsletter. So please keep in mind what resources, a little bit about you. Of course, I'll put your website, but any case studies, anything that comes up in the next few days, please share with us. I want to get that up about you and your company, what you're doing.
Yeah, that's great. I mean, I think there's ways through both either our BioFlight VR website, and you're going to post that information, and through the CareXR site. There's a lot of ways to connect with us. I think Suzy mentioned our partnerships with hospitals. That we're doing both right now. We're open for new alpha site and beta site partners for the products, and we're eager, like I said, to work with you first, and then figure out the partnership beyond that. And then, in developing our library and co-developing our library. We don't work with just one hospital to develop our content, because not every hospital is experts in everything. And probably in the different areas I just mentioned, across those different specialties and different needs for home care at home, there's so many different areas we would love to talk to people out there that have a need and are thinking about solving problems using a platform like this. Would love to talk to you about how to build something together. That would definitely be something we're interested in chatting about. And so, yeah, different ways to reach out to me through emails, and I'm definitely the right person to talk to, because if you talk to anybody else at the companies, they're just going to point you in my direction anyways to have a chat. So.
I love it. Well, they can also find you on Peds Marketplace, right?
They can, yeah. We are on Peds Marketplace. Like, that's an example of another innovative, great way for hospitals that are leading in innovation to find products that solve other hospitals' problems. And so, thank you for mentioning that. Like, we're trying not to duplicate it. Like, every hospital shouldn't go out and build their own CareXR. Like, why do that? We spent a lot of money in 2 years to do it. Like, let's just stand on our shoulders and let's build something together. If you want something a little different, let's figure out how to do it. But yeah, don't start from zero. Let's figure out how to scaffold on top of what we've already built. So we are on Peds Market as well as the app stores and then our websites as well.
Awesome. Love it.
Thank you.
All right. Until next time. It's been awesome having you on, Rick. Thanks again. Really appreciate it.
Thank you, Michael. Thank you, Suzy.
Of course.